Hello, everybody, ladies and gentlemen. It's been a long time, long time no see. And today, I'm going to spend this next hour talking about something that's very interesting in our daily practice. We call the blood pressure and heart rate. It's just a science for us to give us some information before we decide what kind of medicine not to use or not to use. It's kind of a treatment strategy. It's very interesting and it's very useful. Even it's very fundamental. It's listed in your textbook in the beginning chapters or something. Looks like it's very easy. It sounds very easy, but because it's in the eight parameter diagnosis principle. It's just the heat and the cold and outside, inside, exterior, interior, in or yang or something like that. Everybody knows that. It's so simple, so easy to understand. But actually, in our daily treatment, sometimes it's even difficult for me to make sure, to be sure this patient is a cold condition or hot condition or a weak condition or excessive problem or something. Sometimes I got a problem deciding which formula to use or which formula not to use. Sometimes it's not so simple to know, oh, this man has a lot of heat, so we use cold medicine. Sometimes we find, oh, this body is cold, we use warm medicine. Not necessarily that simple. So today, I sometimes, actually every day in my daily practice, I rely on these principles, these 4 types of things I'm going to talk about for you today. If you have any questions, feel free to ask anytime, okay? So the first type 1 is the blood pressure. Can I ask questions? Yeah. How many people you have a blood pressure gauge on the desk? Actually, I should ask, how many of you, you're practicing, how many of you have a desk for your patient? I've seen so many clinics that they don't even have a desk for the diagnosis, for everything, for the patient. They just ask the patient, go to bed for the acupuncture. That's really, really funny. How many of you have a blood pressure gauge at your desk?
So far, 3.
3? About 3%. Okay, that's not good. Because
4, 5, 6, 8.
8. Okay, good. Coming in. You know, it's not the blood pressure stuff. It's not only a tool that we can use for some decisions to make. Also, it can protect yourself because there is a thing we call, I don't have a term. I just call it invisible blood pressure. Sometimes when you take pulse, how many of you has been to my pulse classes? Can I ask?
Yeah, can you put in chat room?
Okay. Whatever.
Yeah, a lot.
A
like
lot?
20%.
Okay.
More than 20%.
Only 20%? Okay. You know, sometimes it's very interesting. You take the pulse, you feel the pulse is very, let's not get too technical, just the feeling. The pulse can be very soft, very weak. So naturally, and the patient's main complaint would be, oh, doctor, I'm so tired. I'm such fatigue. I feel like sleeping all the time, something like that. And you would naturally give him something like to tonify them, like 十全大补 or other stuff. But actually, this person can suffer, and especially they have an anemic face. The face is pale, the fingertips are pale, and everything looks so obviously it's anemic. So naturally, you will give them something like 十全大补, 补中益气 to tonify their energy. Then it could be a problem because they could be suffering from a kidney type blood pressure condition. The blood pressure can reach up to 200 or something. But the symptoms are showing he's very weak or she is very, very, very weak and tired. So taking a blood pressure is not just an ordinary routine procedure. It's a way to protect yourself from making some deadly mistakes. Any questions?
No.
Okay. Okay, let's go to the first type 1. This is very, very easy and very useful. You can take your patient's blood pressure before you make any diagnosis. This stuff will give you a lot of hint and the direction to follow. Okay, blood pressure systolic is above 140 or 150 or 160 or something. Diastolic is about 90, 95, 100 or something. Heart rate's over 85, 89, 90, 100 or something. Let's pretend this patient is not taking any blood pressure medicine. He's free. He's clean. He's fresh. So, what kind of a condition, generally speaking, because we know that the term, the heat, the cold, the excess, and the deficiency, something like that, it can happen in different part of the human body, not necessarily totally the same thing. But in the blood pressure type, we just talk about the whole general condition. So generally speaking, this guy is in what condition? Excess or deficiency?
Excess.
Excess. And
Heat.
oh,
Jump ahead of you.
in the chat room. Okay, is heat or cold? Of course. It cannot be what? Cannot be cold. So definitely some heat condition. So no matter what, the point is, no matter what the complaint is, don't be misled by their sayings. The most of people the patient will give you wrong information. Some people don't even give you anything. They want to ask you, hey, you find out what's wrong with me. But anyway, in this case, there's definitely some excessive heat in this human body. So no matter what, even the main complaint or the major symptom he has is, oh, doctor, I'm so tired, I'm so weak, I'm so have no energy, have no libido or whatever. Don't give him anything to cause more problem. For example, what kind of medicine or formula we do not give to this person? Actually, it's very easy. No answers. We do not give him 十全大补, right? We do not give him 补中益气. We do not give him 四逆汤. We do not give him even the major complaint is a very low libido, or even for the condition of infertility, do not give him any like what? 还少丹 is fine, but no 贵妇地黄. 八味地黄 is kind of hot. And don't give him 右归丸. You can give him 左归丸 to clear the heat. For deciding what formula to use, I have a little formula for you for reference. I use this formula a lot. This formula is not for whole body. It can do individually in different areas of the pulses, like at least 6 pulses. 6 positions, 寸关尺. And also above the 寸, like 奇经八脉, remember? And the 奇经八脉 beyond the 尺 area. The pressure, the P is the pressure, okay? The pressure actually is the difference between the pressure from inside the blood vessel and the pressure from outside. Actually, it's the difference of the pressure. T is for tension, R is for radius. So very easy to understand. So in this pulse, remember my six pulse, the big pulse. Remember the big pulse? This is the type 1 is something like the big pulse, because if the blood pressure is high and the heart rate fast, means that the guy is in a big fire. I always say, hey, your body is like a volcano. It's dangerous. You might get the stroke or something. So let's and by checking the blood pressure, you cannot tell anything about the shape or the feelings of the arteries. But this can tell you something. R is a radius. And in this condition, type 1, we don't have number, we just use arrow. The radius is high or low, is big or small. Of course it's big, right? The condition is expanding, so the blood pressure is high, heartbeat is right. So he has this kind of force on his arteries, expanding. And the T, how is the tension here? Is high or low? It's high. Because this pressure is high, that means 这个分子英文叫什么？这分子分母啊。In math. So denominator, if this answer is high, this number must be very high. Is it correct?
Denominator 分子 denominator
分子除分母，这个数字高。If this number is high, this number got to be very high, because this one is already high. This number must be very, very high. So, in order to treat his blood pressure, I use this formula as a reference. How do we treat it? This kind of blood pressure. For example, he's not taking any blood pressure medicine, and some people don't like to take medicine because it makes him sick or make him have side effects for men, the sex ability or other discomfort. And what's this? What is this? 这什么呀?
different color.
Okay. Oh. So what do? This is a very interesting formula. It's not exactly a formula, but just something can show you what kind of medicine to use. What would you like to use for this kind of treatment? Because at least, if we want to lower the blood pressure, obviously we'll have to lower this number, right? Make it low. So get rid of the tension. I will use 玄参、决明子、荷叶 lotus， 还有那个叫什么海藻，昆布海藻。And how do we release to get this R smaller by lowering this? Not necessarily. All you have to do is do this. And of course, in this condition, we have to use something for the peripheral sclerosis, like by using 毛冬青. So that's a formula I use a lot for blood pressure, high blood pressure. It works very well. Or, okay, let me give you a whole idea 哈。你写好了。毛冬青40，学生20，那个海藻20，那个荷叶或者是那个决明子 ，or 再一个 or 或夏枯草20。Okay? I'm sure this guy was suffering from some kind of water retention edema. If he or she is not, the 毛冬青 can be replaced by 地龙 40%.
People will like 毛东西
Yeah.
taste better.
So, this is how we deal with the high blood pressure stuff, by the feeding, by this simple formula. Lower the tension and yeah, because this guy, we're talking about high blood pressure here, right? Big fire. So why we use 海藻 and 地龙? Because 地龙, these things are salty and cold. 玄参 is very salty and very cold to get rid of the hardness, the arteriosclerosis. So the blood pressure will be a lot better. Okay, any questions?
No question?
Okay.